Where were we? BSI. Scene what? So we were in scene survey, and we talked about BSI, and then what was two? Scene safety. Okay, so let's go here. So scene survey. Now, one, BSI. So we got gloves. We'll come back to this. We're gonna introduce the whole glove process tomorrow because you're gonna be in people's grill, okay? So gloves, mask, okay, etc. So two, scene safety. Okay, that's gonna be my shorthand. You're gonna see X's a lot of time. I'm just shortening things. Scene safety. So these are moves. Okay. BSI, scene safety. What's three? Okay, number of patients. That wasn't good. Okay, number of patients. Now, I already talked about roll call. Although what I didn't talk about is mass casualty. So what we refer to as an MCI, which is a mass casualty incident. Mass casualty incident. So boom, I come over here and I say MCI. So what happens when we have a mass casualty incident is that we need to do the greatest good for the greatest amount of people, okay, with limited resources, meaning there are more injured than there are rescuers. And so we categorize people into four quadrants, okay? Into four, and what those are is green, yellow, red, and black, okay? Now, the way a mass casualty incident would work, now we bring these into play because one, they're not very common, but for instance, in the Tetons, we have this reoccurring theme about every 9 years, we're due for one, which is we get multiple people struck by lightning, okay? So, as I often joke, in the wintertime, I forecast avalanches. In the summertime, I forecast lightning. Okay? If you're up above tree line in the Tetons, it's important to recognize there is no place safe. Why? Because it's rock, and then the rock gets what when it's thunder and lightning? Wet. And then when a lightning strike hits, where does the current go? Everywhere. There's very little resistance above tree line. So I just like to remind folks where it's like, I normally put a 2 to 3 hour buffer between me above tree line and incoming lightning. That's how low my tolerance is for it. Why? Because I happened to live in South Florida at a time when we had a PGA event going on up in Jupiter Hills. I was a golf caddy. That's another weird life of mine. And we had a PGA event going on, and clear day, blue sky. And we have a gallery member, a spectator, goes walking across the 9th green in the alley, which is designated for them to walk across, and out of blue sky, out of the blue, boom, he gets nuked right on the 9th fairway. Yeah, exactly. 28 miles away, the individual was struck by lightning. So my tolerance in the Tetons is extremely low. So big buffers in regards to lightning. Now, MCI. We code people according to in terms of their injuries. So how this works is for instance, you come in, you got a group of people, and ultimately you're gonna walk in and you're gonna, hey, anybody who can, come with me. Anybody who can, get off scene. So we call those folks walking wounded. And we basically clear the field. We're like, okay, great. These people they're not getting any help. They might have injuries, but they're managing them on their own, and they're not significant enough where we need to put a resource to it. So those are walking wounded. Now, and the easiest way to deal with this is that the more somebody complains, the more you can ignore them. So the more pain somebody's in and the more they let you know they're in pain, they ain't dying. They're not dying, okay? Because death is not, hey, man, this hurts, like, holy cow. It's more like, it's really quiet, okay? So what we're gonna do is as we assess individuals, arguably we're gonna make note of individuals who are perseverating in pain, right? We will check in with them, but ultimately what we're trying to do here is we're trying to make the difference between stable, okay, or I'm sorry, stable and critical. Okay. Now, stable does not mean that they have no injuries. It just means that they're not dying anytime soon. Okay. So, for instance, a broken leg can be extremely painful if it's unstable. And when it's unstable, what's occurring is that you have a bone break, and then the muscles are contracting around the bone, and it's jamming the bone ends together. Okay. So you actually have a full break where it's not lining up. For instance, you can have a fracture where it kind of, you get the break, but it stays intact and then the muscle group holds on to it. That's a stable fracture versus an unstable fracture. The unstable fracture is much more painful. So individuals that are stable ultimately have injuries, but they're not dying. And then red is critical. Okay, so, and then the last piece of this, black, is dead, okay? Now, dead is pulseless, breathless. What we do for these folks, because we don't have enough resources to do CPR for folks, anybody who is breathless, pulseless, what we do is we open their airway. If they start to breathe, they then become red, okay? So they have to start breathing on their own. So we just do a head tilt chin lift for them, open up their airway, make sure it's not occluded. We'll show you how to do all of that. And if they start breathing on their own, roll them up onto their side. You'll learn that tomorrow. And they then get coded as red. And this is first evac. And then this is second evac. So that's our MCI, kind of down and dirty. Any questions about that? If they don't start breathing, we code them as black and they're deceased. There's nothing to do. We don't, because ultimately if you're gonna start doing CPR on somebody, one, if it's a trauma event, okay, CPR is not gonna work, okay? Although in lightning, what's interesting is, and we'll talk about this, is that in a lightning event, you may give them 2 breaths, okay? Simply because those are respiratory arrest, and sometimes the heart is still beating, although they're not breathing. And we would give them 2, and so if we knew that there was a lightning protocol, or I should say if you knew there was a lightning incident or a drowning incident, as you're pulling these individuals out that are not breathing, they get 2 breaths, and if they're not breathing after that, they're considered deceased, okay? Those are called rescue breaths, and those are just 2 quick breaths, and generally those individuals have a pulse, but for instance, anybody who's struck by lightning, anybody who is in a drowning event or a near drowning, anybody I pull out of avalanche debris, those are all considered respiratory arrest. They can go into cardiac arrest, but they'll go into respiratory arrest first. And the heart will continue to beat for 1 minute without respiratory support. After that 1 minute, the heart will shut down and they'll go into cardiac arrest, okay? Okay, anything else up here? Yep, no sweat, no sweat. Anytime the resources are in deficit of the victims, okay, and these can be modified. These are sometimes modified where, for instance, So like the easiest way to explain it is like on the ground, the last time we had an incident, we had 11 people that got struck, and they were all over the place. And we had 8 people in one spot. And so it was easy to, like, when the rescuers first got to them, they were the first 2 that showed up there were basically categorizing who was priority. And they were treating the reds, the criticals first, and then we were pulling the yellow out of there second. In that particular situation, we had 1 deceased that was actually over the edge, and we couldn't even get to him. And then, so it depends on the numbers, because for instance, if you had, let's say you had, say you have like a combination of 3 greens, 3 yellows, nobody's red, and you got 1 black, and you've got 5 rescuers, you might push 1 rescuer just to that black and treat them. Does that make sense? Yeah, as long as you're able to cover everybody else appropriately. Okay?
So it's really what you can put on the ground in relation to where they're spread out. Because you have a whole bunch of resources behind helicopters, dispatchers, that's what's boots on the ground versus distant.
Exactly. The greatest good for the greatest amount of people. Yeah, and so ultimately, we lose people in MCIs, and we expect to, but we're also saving everyone that's viable, or trying to. Okay. All right. Excellent. Okay. So number of patients, and then we go into 4, which is consider backup. Now, of course, this is our 911, okay? Nothing new there. Now, number 5, MOI versus NOI. Again, nothing new here, okay? This is trauma versus medical. The one thing that I want to add to this in regards to the upgrade, which is that when we have spinal injuries, they are, for instance, I don't know if we've ever had anybody that's had a spine injury while they were hiking. Why? Because the injury pattern doesn't match up with the activity. So for instance, in hiking, what do we see? We see ankles, we see wrists, okay, because these are falls from standing height and they catch. Sometimes they'll break an arm, but generally we need some velocity with that, which is they were moving quick downhill, trip, and then they're moving faster. And if they've got large weight on their back, that's when we start to see forearms break because of the weight. But day hiking, it's pretty rare to break a forearm, although the wrist and hand, quite common. For instance, this is a fascinating thing. So St. John's ER, emergency room. Who's the biggest frequent recreational flyer that comes into the recreational injuries? Who is it? Said it? Horseback. Horseback is number 1. Okay, we see more horseback injuries come into St. John's than it pales in comparison to skiers. And folks are like, really? And I'm like, yeah. Do you know how many people come here from down country and think they want to be cowboys and they want to like hang out at the ranch? And then if you look at how many ranches we have and how many horses we have in the valley, there's so many people that we put onto horses. And what do they not have with that horse? Bingo, they do not, well, they don't, right? Yeah, but they don't have a relationship with the horse. And as I joke with folks are like, let's go horseback riding. And I'm like, I don't live on a ranch. I didn't grow up with a horse. And they're like, yeah, no kidding, but like, come on, it'll be fun. And I'm like, you don't get it. That horse wants a relationship with an individual. And when you develop that relationship, you create a bond, and then they're less likely to injure you. And then if you're a stockyard animal that gets ridden all the time, what do? You get pissed off every once in a while. You're like, I'm gonna pull up shorter, I'm gonna buck this jerk, okay? And that's ultimately what happens. So deceleration is the key to spinal injuries. Deceleration. So for instance, if you go to the terrain park, okay, up at the village in the wintertime, we have these transitions, okay? And what happens is that skiers come down, boom, they hit the transition, and even if they blow the trick, they come into the landing, and if you hit the landing right, which they normally do, they hit the landing and they don't stop. They slide through the transition and they don't stop that quick, so they don't get injured that badly. But if you ever notice the snowboarders, what they end up doing is they either come up short and hit the landing up top, they hit the tabletop, or they miss the landing altogether and blow through it. You guys like my joke?
Yeah.
Okay, skiers do that too. I just like picking on snowboarders. Come on, I was a teenager in the 80s and this was a thing. Not so much anymore, but still it's fun. Okay, throw a little old school culture into it. There's a reason why we call it backcountry skiing, but I digress. Okay, but the point is that you miss that transition and you land flat, okay? Horseback riding is fascinating, which is that if you get bucked off of a horse backwards, you're actually likely to break your hip. Why? Because you get bumped off, and then when you land on your backside. But when the horse pulls up short, you're holding on to the reins, and the horse pulls up, drops its head, and your hands get pulled underneath while you go over the top. You can't catch your fall head first into the ground, and you decelerate rapidly. The faster you decelerate, okay, so the more velocity you have and then come to a stop, the more likely you are to break a bone, okay? And so for instance, where do we see head injuries? We do see them in skiing, okay? Although not as frequently as you would expect, unless you're in a couloir. Why? Because they pinch, people blow it at the pinch because that's normally the crux, and they hit the wall, and then they bash their head in that process, or a tree. It's interesting because in the tree situation, normally folks are getting hands up and their faces up, whereas when we get into the couloir and people are blowing it, they're getting turned and they're unable to protect themselves because they're not aware of their position. For instance, paragliders generally break their hips, okay? Why? Because they're in the basket. When they get dropped out of the sky, they get dropped onto their hips. When they get pushed into walls, that's when we see head injuries, okay? So there's injury patterns that are associated with all of these. Once you start to understand the injury pattern associated with your activity, then you can start preparing appropriately for the injuries you would expect to have, right? So you don't need the big bulky first aid kit all the time because it's going to depend on what you're doing, okay? Going out on a day hike, normally blisters, bumps, bruises, maybe a wrist, okay? Mountain biking, anybody know what the injury for mountain biking is? Yeah, exactly, it's collarbone, right? Boom, over the top, get the arm out, yep, get it out there, that's the best way to break it. and you're gonna snap your collarbone. So injury patterns, okay? 6 spinal precautions. And this is simple, okay? The question we're asking is hold head. Are we gonna hold the head, okay? Now, this is a weird thing because you're gonna come into this tomorrow in regards to your primary survey where you start interacting with the patient. Kind of like the historic approach to this thing is, and I laugh about it because of how biased medicine would be, which is that we treat based off of mechanism, okay? And so what that does is it creates this awkward thing where there's been a mechanism and nobody has hit their head and we don't know if they've hit their head, and we walk up and we're like, hey, how you doing, man? Right? And we walk up and grab the head. Generally speaking, that is not the best way to approach a patient because you don't have a relationship, and if there is a head injury, you're going to scare the daylights out of them until you start to interact with them. With that being said, individuals who have head injuries, head, neck, spine injuries, and they're conscious, they know it. They know it. And so, for instance, in medicine, commonly what we do with folks is that we get on the plane with them in order to control spinal precautions when we begin to talk. We're like, hey, don't do any extra head movements just in case you've got a neck injury. They're like, yeah, no problem, got it. And you're like, okay, awesome. Yeah, right? Okay, so hold the head. We'll give you very specific protocols around when you're going to hold the head, and then if you're ever uncertain, hold the head. Okay. 7, general impression. Okay. Now, are we good here? Is anybody not good with what's going on here? Okay. Now, here's the problem. Scene survey. We talk about accidents. And I used to think there were accidents, okay? And the problem is that when I came into search and rescue and I started working on the investigative side of things, ultimately, what I began to find out was that there were no accidents, because accidents are unforeseeable, okay? And the problem is every time we investigated, we were like, this is why this happened. And then sometimes the individual would go, oh yeah, but we were doing everything right and this and that. What is that? What do they have? Bias. Yeah, and what's crazy is we call it blind spot bias, okay? And what's going on is that the individual is reacting in a protective approach to themselves in order to protect their ego, okay? Because their emotional state can't deal with the fact that they caused what happened. And for instance, it's like people are like, yeah, but I just tripped and fell. And I'm like, yeah, your blood sugar was likely low. That's another thing that we know, is that individuals who have accidents at the end of the day, which is when 85% of the accidents occur. And then as I came into structured medicine, one of the things that we do when we intake patients is we check their blood sugar levels. And almost everybody had low blood sugar levels. We're like, no kidding, you're tired. You're not adequately hydrated or nourished, and then you're at the end of your day, and then you're tired and you trip and fall. And so people are like, yeah, but and it's like, well, I'm sorry, this is the observables of these things, right? And then it's like, for instance, like people used to argue with me about this years ago, and now we understand avalanches much better. And it's like, and it's the thing that's fascinating for me about it is that it's like, no, I get it. It's hard to see it when your desire is that outcome of skiing something. So you're like, okay, everything looks good. Well, what are you looking at? Because the forecast, the problem is that every time we have an accident, all you have to do is go and read the forecast for that day, and the forecasters have literally picked the terrain that the individuals have gone into and had that accident. They're like, this is where it's going to happen. You should stay away from this. And so again, it's lack of experience or extreme desire. So they're all incident. And then this is the ownership that we have when we go into it, where it's like, as I've said to folks many a times, I don't mind coming to rescue. Just don't act like it's my responsibility to bail you out. It's my service to the community. And yes, I will put myself at risk in order to do it, but please don't expect it. Why? Because we screw up and we make mistakes. So own it. It makes it so much easier on your rescuers when you're like, I screwed up. Thank you for being here and bailing me out because I blew it and I made a mistake, even if I don't even know what my mistake was, because there's something to learn. Now, this is what I refer to as the preventative survey. And it fits into this as a mirror image, except you're doing this before you go out into the field, because if you take care of these things before you go out, you're actually less likely to be in an accident. And this is statistically accurate because when we do incident reports on an accident, these are the problems that we find people doing. So one, instead of having BSI, one is PPE, and that's personal protective equipment, okay? And so for instance, if you are new to hiking and backpacking in general, what do we normally recommend for the type of footwear that an individual should use if they're carrying a heavy pack? Boots, something that has an upper cuff on it. And then as you get more experience, you can get your pack weight down, and then you can get into sneakers. But it's interesting, today what we're seeing happen is that individuals don't have the experience in the terrain, but they get the technological approach where they're like, oh, I can lighten up my pack, and then I can get these, and I can just wear my sneakers out there, and then they roll their ankle or blow their ankle out, etc. So experience does play into this, but appropriate PPE based off of your experience as well, okay? So for instance, in rock climbing, as I've talked about, it's helmets, harness, etc. Why? Because that's what you need in order to be able to rescue somebody. If you're on the river, you should have a Z-Drag, you should have a Z-Drag kit, you should have your PFD, possibly a helmet with you as well, and know how to use that Z-Drag, etc., right? And have some swiftwater rescue skills. So appropriate PPE with the appropriate training. Now, scene survey, scene safety. How is it that we define scene safety in regards to interacting with the terrain? How do you find that out? What information do you need to gather if you're going on the river, if you're going backcountry skiing? Of what?
Of the weather or the river.
Excellent, excellent. Okay, and so this is weather and condition. And so, for instance, still like to ice climb a lot. People are like, that's really dangerous. I'm like, sometimes. And other times it's absolutely amazing. And it all depends on temperature, water flow, conditions, and you need the experience in order to be able to evaluate it. It's like backcountry skiing. People are like, you ski on high days. I'm like, yeah, no kidding. I avoid the terrain where I'm likely to get snuffed. And so I'm using the terrain to my advantage because of experience. I couldn't do that 30 years ago. 30 years ago when I was backcountry skiing, I went when it was a freeze thaw. Why? Because it was really easy to identify the hazard. Oh, it's getting warm, let's quit skiing. We would just get out of the terrain. And then as we got more experience, okay, now we start to interact with different terrain and different conditions. If you're going on the river, okay, and you can't paddle class 4, well, don't go when the flow's too high, right? Wait till the flow goes down and it's a little bit easier to manage. Or maybe you wait until it's really high and everything's washed out and you don't have to worry about it. Okay, so weather and conditions. This is something that I find fascinating simply because, for instance, historically when we used to climb the Grand, we used to do it in mid to late July and all of August and September. And now today, like, we guide it in June. And I joke about it. I'm like, you want to make the Grand hard? Go climb it in June. You want to make it really easy? Climb it the second week in August during a weather window. And you can generally do that in a pair of shorts and a t-shirt and a windbreaker, okay? And whereas you do it in June, you're gonna need crampons and ice axe, you're gonna need multiple down jackets, you're gonna carry a lot more gear, okay? So different experiences. Now, number of patients, okay? Now this, not 4, 3. Number of patients is group dynamic. Now, I ask a couple of questions here, okay? One, am I guiding? Two, am I being guided? And then, are we facilitating a group experience? So let me put this into perspective for you. Why do I ask these questions? Why? Because, so for instance, in the wintertime environment, I have a pretty favorable skill set, okay? I have a pretty favorable skill set in the winter environment, which is I've been working in the snow and avalanche continuum for about 30 years. I've had some mentors that have very much put my head on straight. I've had some close calls that have nearly killed me. And today, it's not perfect, but the problem is it's better than most in terms of my assessment. And so generally when I'm going out with individuals, even my close friends, I'm guiding, okay? Now, there are also some days where I am co-guiding, okay? And meaning that the other people that I'm with have very similar experience profiles and knowledge base, and therefore we work more in a group consensus around the decisions. But oftentimes when I'm with my friends, I'm in a lead position where people are like, is this cool? We doing this? And I'm like, yeah, no, depending, right? Now, occasionally I have a handful of friends that have similar experience with me as me, but they got a lot going on too, and we don't get to hang out very often. But when we do, so for instance, our guidebook author in the Valley, Tom Turiano, if you don't know him, he's a full legend. And Tom has skied and climbed everything. And then he wrote about it so that all of us could do it. And when he was doing the research for his book, he used to call up me and two other friends, and he'd be like, hey, you free tomorrow? I'd be like, yeah. He'd be like, great, Albertsons, 5 o'clock in the morning. We're like, awesome. And then I'll never forget it because we had this one friend of ours he is who he is. He's a little flighty. And he would often be like, he'd get there and he'd be like, what are we skiing today? And Tom wouldn't be there yet. And our other buddy would go, I don't know. It's going to be the best thing you ever skied. Tom's guiding. And it was true. Meaning we never had to make any decisions at all when we were going out with Tom. Why? Because Tom had a full agenda and Tom's protocol was so dialed that you didn't ever have to question it because he had huge safety margins in his system. And so the amount of risk that you were taking was generally pretty low, and you knew that. So as long as you felt comfortable about skiing in the conditions that we were going in, there was really nothing to worry about. So on those days, I could literally turn off and be like, awesome, show me something, take me to somewhere new, teach me a technique, awesome, I'm here to learn, and just consume it, and I don't have to work. And then the last thing is are we facilitating a group experience? And I think it's important for folks to recognize that when you're facilitating a group experience, you generally need to roll the risk way down. Why? Because you have too many people that don't have enough information, and if you're not working with a professional guide, it's really difficult to force people into assuming risk. And so at the end of the day, when you're facilitating group experiences, this is interactive environment with other people. And the way you develop trust is by conceding or consoling the individual at the level they're at, not ramping up to where you are, because that's bullying. And then the problem is that even if it works out, and you're like, see, that was totally fine. They're traumatized because they were in fight or flight. And they're like, oh, that was amazing, but why do I feel so? I feel like I'm gonna die. Right? So that's what's going on, right? And so what's happening is that we just have to recognize that these group experiences, I talk about it all the time. If you want to hang out with somebody, you want to go on a date, dial the risk down. Ladies too, I've seen ladies do this where I've seen you traumatize men with this as well, because you're like pretty badass skiers too, and then you also have some experience, and sometimes you're like, hey, come on, let me show you a thing or two. You traumatize the boy. It works both ways, okay? So it's really important to recognize that risk is something that we dial down until we have relationship. And this is a fascinating thing in terms of what's happening with social media, which I'm seeing today, which is that individuals are finding partners that they've never interacted with and then engaging in levels of risk that are generally things that take some period of time to develop a relationship with somebody that you trust, understand how to communicate and operate with them in order to be able to manage the risk. And that's the power of that relationship, okay? So group dynamic, number of patients. Now 4, consider backup turns into what is the experience profile of group, okay? Of group members, okay? Consider backup. Why? Because what I'm trying to figure out is, am I the only one that's gonna be responsible for rescuing, or do I have other individuals that can rescue me? And that dictates where my level of risk tolerance is gonna be based on if I have individuals that can bail me out if I blow it, okay? And so commonly when I go out into the field in the avalanche realm, I say to folks, I'll be like, hey, I'll be primary rescuer today. Who's secondary? What am I asking? Yeah, who's gonna run the signal search when I get buried? Okay, so we already have that. So we already have that order of operations and that leadership established before the incident occurs. Okay. 5. This is weird. MOI, NOI. Okay, so these are the hazards or the result of a hazard, and so 5 is what are expected hazards. Okay, what are the expected hazards? And then 6 follows up with, how do we manage expected hazards? Okay. If you guide in this valley, what you're and you're new to an organization, what you're going to experience is that there are generally legacy guides in that organization. Those are the best organizations to work for. There should be somebody with gray hair in the organization that makes fun of you for not having enough experience, and you go, you're right, like literally. Why? Because they know what is going to kill you. And so, for instance, when you work on the river, it's interesting. The biggest problem we have is on scenic floats. That's where we kill people. Why? Because of strainers. Okay? And so what all the guides are doing is they're all communicating with one another on a daily basis of the conditions of the changes in the river, so that they can then expect how to manage that hazard because it's changed from day to day. Hey, we got this new strainer on this side, it's river left. Make sure when you come around this corner that you're out on river right, so that you can avoid that strainer. Okay? In terms of like going up onto the Grand, it's like there are protocols in place in terms of when helmets go on clients, because they go on before the hazard exists, and then harnesses go on in a comfortable area before you need to rope up, and then we rope them up before we need them roped up, so that we can then have them protected when we come into the hazard. So we're managing these hazards on the front end and have a protocol associated with it, and it's institutional. We do the same thing every time. And then that way, and then we continue to communicate those through legacy. If you go up and climb the Grand and you're going up to the lower saddle, right before you get to the lower saddle, coming out of the moraine, you have to go up a fixed rope. And it's interesting because when we're in the moraine, we put our helmets on. Why? Because right when you walk up to the head wall to get onto the fixed line, people are spitting rocks down. They're little rocks, but they're spitting them down on you. And it's classic because you'll be up there, you'll have your helmet on, and then you'll see folks coming up and they don't have their helmets on and they're walking up and they're like looking at you really weird. And we're like, yeah, we look like geeks, but wait a second. And then rocks start and they're like, ah! And they're like digging for their helmet. We're like, right. You haven't been here before, so you're not aware of what the expected hazards are. Pay attention to the guides in this valley. Why? Because somebody has shown them how to institutionally manage existing hazards. Everybody that gets injured on the Grand, it happens in the same place. It's generally the same experience profile, and it's generally the same demographic, year after year after year after year. Why? Because they're not in the loop of the culture, okay? 7, nothing changes, general impression, okay? And so based off of the information here before you're heading out, what is your general impression of how you're gonna, the conditions, the equipment you need, the conditions you expect to run into, who is in your party, what their capabilities are, what hazards you expect to run into, and how you're gonna manage them. And if you come up with those protocols, and if you keep doing it over and over and over and over again, I guarantee you'll become a sage, okay? And it seems like you're this mystic that can forecast the future, and you're like, no, I'm just making sure we don't repeat the past, okay? All right, questions up here? Z, Aaron, anything for these guys?